Did you know that nearly 6.2 million adults in the US have heart failure? That's a staggering number, and it's only expected to rise. Heart failure is a serious condition that can lead to major health complications or even death. So, if you think you're in the clear, you might want to think again. Today, we're diving into a super important topic: heart failure. It's something that a lot of people don't know much about, but recognizing the warning signs early could save your life. So, grab a snack, settle in, and let's get into it. Now, here's the thing. A lot of folks think heart failure is an old person's disease. I mean, when you picture heart failure, you probably see someone in their 60s or 70s, right? But here's the kicker: it can affect people of all ages. Younger adults are increasingly being diagnosed with heart issues due to lifestyle factors, like poor diet, lack of exercise, and stress. The truth is that heart failure doesn't discriminate. It can sneak up on anyone, and that's why it's crucial to be aware of the signs, no matter your age. Shortness of breath. The first early sign of heart failure you should never ignore is shortness of breath, also known as dyspnea. This can occur during physical activity, at rest, or even while lying down. It happens because the heart is not able to pump enough blood to meet the body's needs, causing fluid to build up in the lungs. Shortness of breath is a common symptom of heart failure and should be taken seriously, especially if it's new, worsening, or occurs without exertion. In heart failure, shortness of breath is often caused by fluid congestion in the lungs, a condition known as pulmonary edema. When the heart can't pump efficiently, fluid backs up in the lungs, making it difficult to breathe. If you're experiencing unexplained shortness of breath, especially if it's accompanied by other symptoms like chest pain or fatigue, it's crucial to seek medical attention immediately. Managing shortness of breath involves treating the underlying heart failure, using medications like diuretics to reduce fluid buildup, and making lifestyle changes to improve heart health. Breathing exercises and using supplemental oxygen may also be recommended in some cases. Persistent cough or wheezing. Sign number 2 is a persistent cough or wheezing, which can be a lesser-known symptom of heart failure. This often results from fluid buildup in the lungs, similar to shortness of breath. If you have a chronic cough that doesn't go away, especially if it's accompanied by white or pink blood-tinged phlegm, it could be a sign of heart failure. Coughing in heart failure is usually due to congestion in the lungs caused by the heart's inability to pump blood effectively. This congestion can irritate the airways and lead to a persistent cough. While coughing can have many causes, if it's persistent and accompanied by other symptoms of heart failure, it's important to get checked by a healthcare provider. Treatment for a cough caused by heart failure involves addressing the underlying heart condition. This may include medications to reduce fluid buildup, improve heart function, and manage symptoms. Swelling in legs, ankles, and feet. Edema. Swelling in the legs, ankles, and feet, known as edema, is another early sign of heart failure. This happens when the heart's weakened pumping ability leads to a buildup of fluid in the body, particularly in the lower extremities. Edema is often more noticeable at the end of the day or after prolonged periods of standing or sitting. Edema occurs in heart failure because the heart's reduced pumping ability causes blood to back up in the veins, leading to fluid leakage into surrounding tissues. This fluid tends to accumulate in the lower parts of the body due to gravity. If you notice swelling in your legs or feet, especially if it's persistent or accompanied by other symptoms like shortness of breath or weight gain, it's important to seek medical advice. Managing edema involves reducing fluid buildup with diuretics, elevating the legs to encourage fluid return to the heart, and wearing compression stockings. Lifestyle changes, such as reducing salt intake and managing weight, can also help. Fatigue and weakness. Fatigue and weakness are common symptoms of heart failure and often the first signs that something is wrong. When the heart is unable to pump enough blood to meet the body's needs, it can lead to a constant feeling of tiredness and a lack of energy. Fatigue can be particularly concerning if it's new or worsening, and it's not relieved by rest or sleep. In heart failure, the reduced blood flow means that muscles and organs, including the brain, don't receive enough oxygen and nutrients, leading to feelings of fatigue and weakness. If you're experiencing unexplained fatigue, especially if it's severe or affects your ability to carry out daily activities, it's important to consult a healthcare provider. Coping with fatigue involves managing the underlying heart condition, improving physical activity levels within safe limits, and ensuring adequate rest. Medications to improve heart function can also help reduce fatigue. Rapid or irregular heartbeat, palpitations. Sign number 5 is a rapid or irregular heartbeat, also known as palpitations. This can feel like your heart is racing, pounding, or skipping beats, and it's often a sign that the heart is struggling to maintain normal function. Palpitations can be caused by many factors, but if they're persistent, occur with other symptoms, or are accompanied by chest pain or dizziness, it's important to seek medical attention. In heart failure, palpitations can occur because the heart is trying to compensate for its reduced pumping ability by beating faster. Irregular heart rhythms, known as arrhythmias, are also common in heart failure and can contribute to palpitations. While palpitations can be harmless, they can also indicate a serious underlying condition, so it's important not to ignore them. Managing palpitations involves treating the underlying heart condition, using medications to regulate heart rhythm, and avoiding triggers like caffeine or stress. In some cases, medical procedures may be necessary to correct abnormal heart rhythms. Loss of appetite and nausea. Loss of appetite and nausea are less obvious but important signs of heart failure. When the heart's function is impaired, it can affect the digestive system, leading to symptoms like a reduced appetite, nausea, or even vomiting. These symptoms can lead to unintentional weight loss, which may further weaken the body and complicate heart failure management. In heart failure, reduced blood flow can affect the digestive organs, leading to symptoms like nausea and a loss of appetite. Fluid buildup in the abdomen, known as ascites, can also contribute to these symptoms. If you're experiencing a persistent loss of appetite or nausea, especially if it's accompanied by other symptoms of heart failure, it's important to talk to your healthcare provider. Managing digestive symptoms involves treating the underlying heart condition, eating smaller, more frequent meals, and avoiding foods that are hard to digest. Medications to reduce nausea and improve appetite may also be helpful. Confusion and impaired thinking. Confusion and impaired thinking are serious but often overlooked symptoms of heart failure. Reduced blood flow to the brain can lead to cognitive issues, such as difficulty concentrating, memory problems, or even confusion. These symptoms can be particularly concerning for older adults and may be mistaken for other conditions like dementia. In heart failure, reduced blood flow to the brain can cause cognitive symptoms, as the brain requires a constant supply of oxygen and nutrients to function properly. This can lead to confusion, impaired thinking, and even mood changes. If you or a loved one is experiencing unexplained cognitive symptoms, it's important to seek medical advice, as they could be a sign of heart failure or another serious condition. Managing cognitive symptoms involves treating the underlying heart condition, engaging in activities that stimulate the brain, and ensuring proper nutrition and hydration. Medications to improve blood flow to the brain may also be recommended. Increased heart rate. An increased heart rate, or tachycardia, can be an early sign of heart failure. The heart may beat faster to try to compensate for its reduced pumping ability, but this can lead to further strain on the heart muscle. While an increased heart rate can have many causes, if it's persistent or occurs with other symptoms of heart failure, it's important to seek medical advice. In heart failure, the heart may beat faster to try to maintain adequate blood flow to the body. However, this compensatory mechanism can further weaken the heart over time. If you notice a persistent increase in your heart rate, especially if it's accompanied by other symptoms like shortness of breath or fatigue, it's important to get checked by a healthcare provider. Managing tachycardia involves treating the underlying heart condition, using medications to regulate heart rate, and avoiding triggers like stress, caffeine, and alcohol. In some cases, medical procedures may be necessary to correct abnormal heart rhythms. Sudden weight gain, particularly over a few days, can be an early sign of heart failure. This is often due to fluid retention caused by the heart's inability to pump blood effectively. If you notice a rapid weight gain of more than 2-3 pounds in a day or 5 pounds in a week, it's important to contact your healthcare provider, as it could indicate worsening heart failure. In heart failure, fluid retention can cause a sudden increase in weight, as excess fluid builds up in the body. This is often accompanied by swelling in the legs, ankles, and abdomen. Monitoring your weight daily can help detect fluid retention early, allowing for timely intervention to prevent complications. Managing fluid retention involves using diuretics to reduce excess fluid, monitoring sodium intake, and following a heart-healthy diet. It's important to work closely with your healthcare provider to manage fluid balance and prevent sudden weight gain. Reduced ability to exercise. a reduced ability to exercise or perform physical activities can be an early sign of heart failure. You may notice that activities that were once easy, like walking or climbing stairs, now leave you feeling short of breath or fatigued. This decline in physical ability is often gradual, but it can be a sign that the heart is struggling to keep up with the body's demands. In heart failure, reduced blood flow to the muscles means they don't get enough oxygen and nutrients, leading to fatigue and weakness during physical activity. Over time, this can result in a decline in overall physical fitness. If you're finding it increasingly difficult to exercise or perform daily activities, it's important to talk to your healthcare provider, as it could be a sign of heart failure. Managing reduced physical activity involves gradually increasing exercise levels within safe limits, using medications to improve heart function, and following a heart-healthy lifestyle. Cardiac rehabilitation programs can also help improve physical fitness and quality of life. Chest pain or discomfort. Chest pain or discomfort is a serious symptom that can be an early sign of heart failure or a heart attack. This pain may feel like pressure, tightness, or a squeezing sensation in the chest, and it may radiate to the arms, neck, jaw, or back. Chest pain should never be ignored, as it can indicate a life-threatening condition. In heart failure, chest pain can occur when the heart isn't getting enough oxygen-rich blood, leading to a condition known as angina. This pain can be triggered by physical activity, stress, or even at rest. If you're experiencing chest pain, especially if it's new, worsening, or accompanied by other symptoms like shortness of breath or nausea, seek emergency medical attention immediately. Managing chest pain involves treating the underlying heart condition, using medications like nitrates to improve blood flow, and avoiding triggers that can provoke angina. What to do if you recognize these signs? If you or a loved one is experiencing any of these early signs of heart failure, it's crucial to seek medical advice as soon as possible. Early diagnosis and treatment can make a significant difference in managing heart failure and improving quality of life. Remember, your heart health is in your hands, and taking action today can help prevent serious complications tomorrow. Thank you for watching, and don't forget to like, share, and subscribe for more health tips and information. We've covered 11 warning signs of heart failure that you should never ignore. Remember, your body is always trying to tell you something. If you notice any of these signs, don't hesitate to seek medical advice. Early intervention can make all the difference. Thanks for tuning in, everyone. If you found this video helpful, drop a comment below sharing your experiences or any signs you've noticed. Also, don't forget to check out our other videos. Until next time, stay safe and take care of your heart.